Hi, welcome back to Aboriginal and Torres Strait Islander Policy HAS350 Lecture 12. So we're going to look firstly at the history of Aboriginal and Torres Strait Islander policy. So essentially there has been a lot happening in this space, and this is really just a snapshot of what's happened at a Commonwealth level between 1969 and 2012, because the next stage is going to be a focus on close the gap and closing the gap and other policies. So let's take a look at what was first introduced. So in 1969, the Australian government made a statement that they wanted to raise the standard of health of Aboriginal Australians to the level enjoyed by their fellow Australians within 10 years. So you will soon notice a common thread throughout all of these policies, which I will come back to later. To help do that, they needed to understand what was happening. They needed to understand what the current statistics were. So a national plan for Aboriginal health statistics was introduced. Look, let's just say it didn't work. And in 1979, the Standing Committee on Aboriginal Affairs found that essentially it hadn't worked for a whole range of reasons. So we then fast forward to 1980, the year before I was born. Well, the Commonwealth introduced a program effectiveness review for Aboriginal and Torres Strait Islander policies. Now you need to remember as well that the reason why it starts at 1969 at a Commonwealth level is because the Commonwealth could not make legislation for Aboriginal and Torres Strait Islander peoples until the 1967 referendum came back as a strong yes, with 90% of people voting in favour of the Commonwealth being able to make legislation. Prior to 1969, the states and territories had had the constitutional responsibility for Aboriginal and Torres Strait Islander people. Then what we had in 1984 was the responsibility for all Commonwealth health programs consolidated with Department of Aboriginal Affairs. So what that meant was we now had a Department of Aboriginal Affairs that governed all of the policy that was actually introduced at a Commonwealth level. So this became the primary focus. Now out of that became the 1989 Aboriginal and Torres Strait Islander National Aboriginal Health Strategy. So this health strategy was significant. It was the first comprehensive policy looking at the health of Aboriginal and Torres Strait Islander peoples. What this policy actually aimed to do was look at it from a whole different range of viewpoints. So it included health education, it included housing, it included sanitation. It was taking a genuine social determinants of view approach. Unfortunately, in 1994, the evaluation of the NAS found that most of it, National Aboriginal Health Strategy, otherwise known as the NAS, found that most of the policies, most of the aims underneath the policy had not been achieved. Now that was for two reasons. One, there was a lack of collaboration between the states and territories with the Commonwealth. And secondly, it was because there was a lack of input and consultation with Aboriginal and Torres Strait Islander peoples. What we then had was the national commitment in 1994 to improve health outcomes for Aboriginal and Torres Strait Islander people. And that's when we saw the first Aboriginal and Torres Strait Islander survey conducted. So this is a health survey that was looking specifically at collecting information that you can't necessarily collect straight from hospitals and stuff like that. So it's, perceived perception of health, etc. And it's really important to understand that this survey was quite small, but quite important. And when I say small, the sample size was small. Then what was established was what was known as HAS350, which is the Office of Aboriginal and Torres Strait Islander Affairs. We have the Office of Aboriginal and Torres Strait Islander Health, my apologies. HAS350 became a sub-department of the Department of Health. We also saw ATSIC developed as well, which was the Aboriginal and Torres Strait Islander Commission. And it was led by Aboriginal and Torres Strait Islander people and responsible for implementing a whole range of policies. Now, health largely remained the responsibility of health, although ATSIC did actually have some health responsibilities. But they also had responsibilities in introducing programs around things like housing, etc. So we then actually had the National Strategic Framework for Aboriginal and Torres Strait Islander people introduced in 2004 that ran from 2003 to 2013. essentially what I'm trying to say to you here is that Aboriginal and Torres Strait Islander policies have changed significantly over time. There has always been good intentions to improve the health and well-being of Aboriginal people, but largely what the evaluations have found, or the policy analysis have found, so when you look at Judith Dwyer's work, when you look at Alistair Thorpe's work, there's been a lack of coordination and collaboration with Aboriginal and Torres Strait Islander people, but also across departments and also across governments. So largely there has been significant investment in policy, and we have seen significant improvements in Aboriginal and Torres Strait Islander health, but the improvements have been not at the same pace or slower pace than that of other Australians. So essentially, all I've been trying to tell you here is that it's a really complex space, and this is just looking at the national policies. So I'm not going to go too much more into the stuff that's on there, but I really want you to think about when you're developing or when you're critiquing policy, I want you to think about the involvement of Aboriginal and Torres Strait Islander peoples in the space, but also the complexity of the space. We know that the healthcare system's complex. You know that from navigating it, but you also know that from these lectures. A number of you in your reflective journals actually talked about the challenging nature of and how confused you were about the healthcare sector. Trust me, that is completely and utterly normal. Most people find the healthcare sector quite challenging. And it's because health is really challenging, but also because of the multi-layers. Now, if we turn to what's happening more so today, we have a significant number of plans and frameworks and guidelines and policies. So this is just a snapshot of some of the more significant ones at the Commonwealth level, but there's also a New South Wales one there too, which I think is really important for you to understand. So I'm actually going to jump on each of these websites and take you through these policies. Going to start with, we'll start with the New South Wales one, shall we? They've changed their website on me since I've updated. All right, let's actually look at the National Aboriginal and Torres Strait Islander Health Strategy. Sorry, guys. So this is National Aboriginal and Torres Strait Islander Health Plan. So this goes from 2013 to 2023. This has an Aboriginal and Torres Strait Islander Health Implementation Plan as well, which is attached to it. Now, I'm actually, believe it or not, writing both the updated health plan, which will go from 2023 to 2033, and also the implementation plan. I'll go through this and then I'll talk to you through the process of that. So this is the health plan. So I'm going to show you something really significant about this health plan, which is this particular part. So what I want you to take particular notice to is the vision to start with. The Australian health system, oh, you can't see this, can you? Sorry. I'm sharing my screen and I'm sharing screen two. So I apologise, I'm just going to move it over to screen two. So let's go back. What we have is the National Aboriginal and Torres Strait Islander Health Plan from 2013, 2023. And then I want you to look at, we're going to look at this diagram. Okay, so what I want you to pay, as I said, particular attention to is the vision. So the vision is the bit that captures exactly what we're hoping to achieve from this plan. So it says, the Australian health system is free of racism and inequality, and all Aboriginal and Torres Strait Islander people have access to health services that are effective, high quality, appropriate and affordable. Together with strategies to address social inequities and determinants of health, this provides the necessary platform to realise health equality by 2031. Right, so let's look at the key words in here. Free of racism, that all Aboriginal and Torres Strait Islander people have access to health services that are effective, high quality, appropriate and affordable. And then they're looking at the determinants of health. Now, the other really significant thing about this, so firstly, actually, this is the first health plan that's ever actually specifically included racism. That cannot be ignored. The second most significant thing is that this is the first time culture has been a key priority. So the cultural determinants of health have become a significant priority in the Aboriginal and Torres Strait Islander health policy space. We cannot achieve health equality by doing things the same way you would do for other populations. Aboriginal and Torres Strait Islander people, as you will have realised over the course of this subject, have different histories, we have different social structures, different culture. All of those things have a role in actually understanding how our health manifests. So what we want to see is a vibrant community-controlled health sector, which we discussed earlier. We want free of racism, and here is where the social determinants, so supported by housing, education, employment, and other programs focused on eliminating the cause of health inequality. So this plan has a strong focus on making sure that we're not just thinking about health in the biomedical model, which is what we discussed in week 2 from memory around the theory of health, which is looking at just in body parts. But what is it that actually impacts our health? So you've got the cultural determinants, you've got obviously racism, but then you've got the social determinants of health. So this is a really significant policy. Now, this is a policy that sets out the high levels, and it's actually taken a life course approach, recognising that mums and babies need different things to children as they grow, and then youth need very different things to, say, adults and people who are ageing. So I think that's something that also needs to be considered, which I've talked about. When you're thinking about Aboriginal and Torres Strait Islander people, it can't be a one-size-fits-all. You have to think about gender, you have to think about location, so geographical location, remote versus urban, but you also need to think about life course. Obviously, you know, I'm 39. Someone who's 15 needs things that are really different than what I'm going to need. So the implementation plan as well sits behind this and actually aims to aims to implement these things by focusing on particular strategies. Now, there's 2 things I'm going to say about this, is that the health plan was developed under a Labor government, the implementation plan was developed under a Liberal government. Now, it's fantastic that a Liberal government didn't just throw it away, but we never saw a significant commitment to the implementation plan, which was sitting alongside closing the gap, my apologies. So the plan in and of itself sounds really good, but there are parts of it that have never been implemented, which is one of the reasons why there is being a new health plan and implementation plan developed. Now, they're not going to be significantly different. So there is a working group that is developing the implementation plan and also advising on the health plan. And then I've been commissioned to be the technical writer on that. So I'm guided by this group of Aboriginal and Torres Strait Islander people who work in the space, but also has public servants on it as well to help guide it and shape it. And we're going to keep the key components of this, but there is going to be a greater focus on the new plan, on the cultural determinants of health. And there was also going to be a focus on where the previous implementation plan had focused on process outcomes, so process indicators. The next one's going to focus on impact and outcomes, which means that what are we actually trying to achieve, rather than just focusing on what we're doing. So let's just have a look at another, sorry, keep doing that, don't I? Let's have a look at the Indigenous Advancement Strategy, which is, here we go. The Indigenous Advancement Strategy was introduced by the Abbott government, and it was seeking to take a social determinants approach to Aboriginal and Torres Strait Islander health and wellbeing. So it had a focus on education, employment, and also healthy communities and homes. It has been a controversial policy, if I'm honest. The introduction was so the introduction was not very good. So essentially what it did was bring, I think it was like 120 streams of funding into 5 streams. What this actually meant that it was then being brought into Prime Minister and Cabinet, say from education, from housing, from health, Department of Social Services, and this caused a lot of issues. It was a massive, massive policy change. Now, there have been Senate inquiries into this, a whole bunch of things. I actually gave evidence in the Senate inquiry around the Indigenous Advancement Strategy when I was working at the National Aboriginal Community Controlled Health Organisation. And again, so the Senate inquiry was part of the evaluation of this particular program. And what that actually found was that the department hadn't followed its guidelines, that had been poorly implemented, and there were significant challenges. And some of the evidence we found from the Aboriginal community controlled health sector was that the Indigenous Advancement Strategy had been heralded by the minister, which was at that time Nigel Scullion, to be innovative and new and exciting, and basically was going to change the way that Aboriginal programs were funded. And that turned out not to be the truth. So they were well oversubscribed. There were significant delays in rolling out the funding, and largely people just got the funding they got before or less. So in principle, this policy looked really good, but was an absolute challenge to implement. Now, some in the Aboriginal community controlled health sector in particular actually say that that's largely because their concerns were ignored. So the consultation process wasn't very good. And also from the time that the decision was made to the implementation, it was actually rushed. So therefore, there wasn't enough time to make sure that it was well embedded and established and set up before the policy was rolled out. Having said that though, the principles of actually taking a social determinants approach are obviously really good. And the IAS is still in existence and has been a number of iterations. And you can see there that there's 5.2 billion to the IAS over 4 years from 2022 to 2023. Now, there are a couple of things I want to say about that. That sounds like a lot of money, but about 50% of that money has gone to mainstream services. Some of it's gone to government departments as well. It's worth actually having a look at this particular policy if you're interested. Lucky last one that I'm going to focus on is the National Aboriginal and Torres Strait Islander Education Strategy. So again, thinking about the social determinants, education, as you've identified, is a key social determinant, and there is a national policy. So it was endorsed in 2015, and the idea is to improve attendance, also early childhood transition. So it means going from, say, preschools or daycare into schools. So it's also aimed at obviously increasing Aboriginal and Torres Strait Islander participation in the workforce. But there's also a focus on Australian curriculum, which Nadia talked about in terms of embedding Aboriginal and Torres Strait Islander content and perspectives into the curriculum. So when we're thinking about Aboriginal and Torres Strait Islander policy, we need to think about the whole range of policies that are in place, from the health specific ones right to the other policies around workforce and education. So I'm going to leave it there. And the next part of the lecture is going to be focusing on closing the gap and close the gap. This is a really important part of the lecture because it really is looking at what's happening today as well, because closing the gap is actually the broader framework under which all of the health policies, in particular education and employment, sits.